Hello and welcome you all to this session of poster presentation on the 9th December 2021, 3 p.m. Indian Standard Time. I, Dr. Tangaraj Balakrishnan, Associate Professor, the Department of Surgery, Nehru Homeopathy Medical College and Hospital, New Delhi, India. Along with me is Dr. Cheshna Nagar. She is a Senior Medical Officer in the Department of Ayush, Government of Delhi. Dr. Cheshna. Extremely sorry for this technical glitch. The theme of today's session is case reports, observational, pragmatic, and randomized control trials, and the sub-theme is case studies. To judge this session, we have a panel of experts. Dr. Sangeeta Dugal. Dr. Sangeeta Dugal is Joint Director in the Ministry of Ayush. Welcome you, ma'am.
And Thank you. I'm advisor, not joint director.
Okay, sorry, ma'am. That's what we have provided with. I'm extremely sorry for
that. I was joint director in CGHS. Now I'm advisor homeopathy in Ministry of Ayush.
Okay, ma'am. Extremely sorry for that. And we have Dr. Preeta Abresha from Central Council of Research in Homeopathy. Dr. Preeta is a specialist in clinical research and drug proving. Welcome, ma'am.
Thank you so much. And good afternoon, ma'am. Good afternoon, Dr. Thankraj.
Good afternoon, everyone. Yeah.
And our technical panel is requested to judge the posters and give the score in the scale of 0 to 10. And I welcome our panelists for today's session. With the permission of the chair, I welcome Dr. Udesh Kumar. Dr. Udesh Kumar is the Chief Medical Officer in the Directorate of Ayush, Government of NCT of Delhi. Dr. Udesh will be presenting simplified homeopathic approach in vitiligo, a key series, and the abstract ID is 306. Over to Dr. Udesh.
Good afternoon, everyone. Thanks to LMHI team for giving me this global opportunity for poster presentation. Can I share my screen?
Yes, doctor.
Yes, thank you can share.
Okay, thank you, sir. As we know, vitiligo is a disease that causes loss of skin color in patches due to loss of melanin pigment. It's affect mostly all types of skin type, but it may be more noticeable in people with dark skin type. The exact causes is unknown. We don't know what is the causes of this disease, but sometimes autoimmune disease causes destruction of melanocyte, which again lead to loss of melanin pigment. In my study, I have seen the cases where symptoms paucity is very less. My symptom are not, we are not taking more symptom many times. Symptom is not available. Due to that, it's difficult to find a similar. I have taken here 6 cases in my study, and in this case, in study, I have taken medicine selected on 3 general symptoms. One is thermal reaction, in which I classified hot and chilly patient 2 division. Next, I divided into, as in table number 1, sweet, salt and sour test, and chilly patient also again divided into sweet, salt, sour, and 1 miscellaneous group where these tests are not available with patient. As in table number 1, as visible on screen, I classify patient to 3 subdivisions. In case number 1, before hand involvement is there, for mainly hand are involved, and before and after, here I given medicine as given in table number 2. In case 1, hot, salt, and consolation aggravation. And in second cases, I use, like patient is presented vitiligo on his face, facial area is affected with vitiligo. And in second, you can see in table, I use hot, sweet, thin build, sulfur is used. And case number 3, as you can see, a small child. Affected area is only cheeks region. In this, I give sweet, and sweet is desire, and thermal reaction host or dominating nature is there with patient. In this case, I have given lycopodium. And case number 4. Patient thermal reaction is chili, desire salt, and patient mostly like cold drinks and cold food. So here I given phosphorus. In my study, I have taken only 6 cases. In 4 cases are improved, mark complete improvement is there with this classification, and 2 cases are remarkable improved. Here, in this cases, mostly I am using this simple classification, and medicine are repeated in lower potency thrice in a day. Medicine potency is increased when case is not responding. Standstill cases, I have used higher potency when case is not responding. In 4 to cases are recovered within 2-3 months, and some cases are taking long time, around 6 months. And in conclusion, I want to say we have to take more cases to evaluate this patient classification for more effectively. And at last, I want to acknowledge Dr. R.K. Manchanda, Director of Ayush, Government Institute of Delhi, for his guidance and support. Thank you, madam.
Yeah, thank you, Dr. Udesh.
Okay.
And
Yeah, I request our esteemed panelists if they have any clarification or questions to Dr. Udesh. Dr. Sangeeta and Dr. Preeta.
Dr. Udesh, it's a
Yes, ma'am.
very nice way of presenting. And I was actually wondering on seeing the title of the your case,
Thank you, madam.
simplified. So I was wondering what is simplified in it. And you have really made it very simple by saying that you have chosen the thermal reaction, you have chosen the desire for sweet sour, and a concomitant, whether it is a physical concomitant or a mental one.
Yeah.
So can you tell me, like, why did you choose these 3 only?
Actually, I have seen many times cases are when we are taking case taking, patients are confused, not able to tell is properly what is his if you take mental symptoms, many times we are not getting, and it patient can easily can understand that sweet, salt, sour in their daily life they can understand. So I mostly divide into 3 things so that patient can easily express his feeling.
And how about the thermal reaction?
Thermal
Because
I divided
I find
into,
it difficult.
no, it means I'm just like hot and chilly patient. I'm taking towards heat. When patient intolerance to heat, I'm taking hot patient. When intolerance to cold, I'm taking chilly patient. It's just
How
2
you are
classification
deciphering
I'm
that?
taking.
How
Means
you
grading
are,
I'm taking 3 grading I'm using. Like if patient is towards heat, means intolerance to heat, grading side. And same 3 grading I'm doing 1, 2, 3. If more is towards hot, I'm taking hot patient, and more is towards chilly, I'm taking chilly patient. I'm not taking here and ambithermal. So it's more easy to understand. Patient also can understand, and we can take a good case taking.
okay. Thank you so much.
Thank you.
Dr. Udesh,
Yes, ma'am.
you have very well presented your case. Really happy. And I wanted to actually know what was the result at the end. Like, though through pictures we are able to see the result.
Yes, ma'am.
Yeah.
Actually, these are the results.
So,
Case 1,
yeah.
case 2. Mostly these cases are focal types of vitiligo. And you can see first case, and you can see this
Yeah.
hypopigmentation, and after treatment, it will take around 6 months. Ma'am.
So how
And
have you graded your result? I mean,
grading means generally I will take repeated
mild
photos.
improvement, moderate, or more?
Generally, I'm taking more. Here 6 cases are maximum improve, all are recovered.
Okay.
You can see like The first cases is remarkable change, and last 6 case number also remarkable change.
Yeah.
Mostly treatment patient we are getting result within 2-3 months after this simple approach I'm using.
And you got the results after
After ma'am,
what
2-3 months.
duration?
Yes,
2-3
ma'am.
months.
Yes, ma'am. After
And
medicine, yes, ma'am.
they are still under your observation. You are still taking their
Yes, ma'am. They
following
are
up.
still in. Yes, I'm following them.
Okay. I think the age we are not able to make out, except ki one is adult or a child.
Yes,
That's right.
ma'am. Yes, ma'am.
In
Yes, ma'am.
case 6, what is the age of the patient?
40
Case
year
number
old
6?
males, ma'am.
40 year.
40 years.
Okay. Fine. Okay. Thank you.
Thank you.
Yeah.
Thank you, Dr. Pita.
Let me call upon the next panelist, Dr. Soumyapatra Dogra. Dr. Soumyapatra is a lecturer in the Department of Community Medicine, Kharagpur Homeopathy Medical College and Hospital. He will be presenting a response of molluscum contagiosum to homeopathy treatment, a report of 3 cases, and the abstract ID is 374. Over to Dr. Soumyapatra.
Is it okay?
Yeah.
Molluscum contagiosum is a benign skin condition having peculiar pearly white or pink lesion. This is considered to be a very contagious disease common in children of low socioeconomic groups. Conventionally, local removal of lesions is primary choice of treatment. Commonly, we treated through cryotherapy. This is a report for a variable period of time treated through individualized constitutional homeopathic treatment. And in this case series, I treated many cases, but marked improvement is noted in these 3 cases. Here in this poster, I only represent case number 1, but in this paper where it is published, there are all 3 cases and its complete demonstration is given. Molluscum contagiosum is considered to be a very contagious disease, and it is mainly noted in immunocompromised states, immunodeficiency patients, and and a group of lesion in face, neck, back, and chest, and they are extremely contagious in nature, and transmissions include direct contact, passive contact, direct sexual transmission. And in this particular first case, I had described a boy aged 5 years presented with dome-shaped eruption on the face with umbilication, 3 in number, for last 2 weeks with no itching, only cosmetic problems are there. And we treated the patient for 2 months. And there is therapeutic intervention given in Dalkamara through the totality of symptoms after repatriation, and taken all the generalities and some particulars. Particularly this first case, we noted that capriciousness is very prominent in the patient, and that the characteristics are also there. They wet weather aggravates the situation, and character of the eruption is vesicular, and if and patient has a morbid desire for urging for urination repeatedly. These all remarkable features make a ground totality, and we taken it through consulted our repertory, and then consult with Metria Medica, and we got Dalkamara as the selective remedy, and we give it Dalkamara 202 doses, and we follow up 2 months. Then we saw that the lesion gradually dried up, and patient is doing well. And last or second lesion, second case, 7-year-old with pearly white this type of eruption with no itching but soreness is there, and there is a concomitant features of diarrhea after eating, and also there are some mind symptoms also there. We select the second case, proton tick, as a selective remedy after consultation with repatriation and materia medica, and first prescription that proton tick, and we follow for 2 months, and after 1 month more there is a aggravation and more lesion is appeared in the face and neck. After 1 month, then we take the case, then that's all lesion slowly gradually dried up. And third case, we taken the case, there is some marked mind symptoms and abruptness, all mind talking slow, delayed milestone is there, extreme desire for salt things, constipation is there, and we consult with repertory and materia medica, and lastly we give the patient the netramure, and after 3 months the patient doing well and all the lesion dried up. As we all know, molluscum contagiosum in clinical practice very common in poor area, slum area, or in children. So to us, this is a very challenging, and people frequently seek treatment for the cosmetic reason, and we treat many cases in our my hospital where I completed my post graduation, the BG OPD section. We got many cases of molluscum contagiosum, and we treated them with constitutional homeopathic treatment, and each and every case we take all the symptoms from the patient, and they are we make a totality of symptoms and evaluation, then repatriation, and after repatriation we consult with materia medica, and also we take advice of the expert, then we try to analyze the case. Lastly, we follow up meticulously and take the picture of the patient. Gradually, we ultimately we take the patient as a whole, and after that we noted that it homeopathy doing very well for the case of molluscum contagiosum. And we before preparing this paper, we also search from many literature review and many peer review journal to for this type of cases, and we got many pioneer personalities also doing about this listen molluscum contagiosum, and case series also there. Thank you.
Thank you, Dr. Somipatra. Any questions from our shares?
Hello.
Good afternoon, ma'am.
Dr. Somipatra, nice presentation, of course. And I have 2-3 questions.
Yes.
First thing, why did you choose 3 cases, and that also among the children? As you said that you got many cases even in the adult population. Why did you choose for among these 3 cases, children cases?
Actually, ma'am, I completed my post-graduation from Mohesh Bhattacharya Homeopathic Medical College, and my topics about delayed milestone related rubrics from Kent's repertory. And I only treat the child group of people, and doing various cluster of cases, and we permutation combination is going there, and we got many cases from molluscum cases. So we jot down the molluscum cases and represent in our weekly seminar also, and make a paper also. But due to my OPD is pediatric OPD, and I got many cases of molluscum, then so I treat them and also make a paper.
Okay. What could be the causative factor for these three children getting this infection?
They are remain very close contact and slum area, and small space is there. Touch is and it is according to theory also, and also practical. We noted that though the space is there where they live, the place is very small, and they close contact each other. So it is infect them, and they are all family member. Many cases we got that they are brother or sister. Yes,
Okay.
that's
Okay. Right. Understood. Okay. Last question. You talked about the second case where Protontic was prescribed. Protontic was prescribed in what potency? You didn't mention.
second case we prescribed Crotontic.
What
Crotontic,
potency? What
200
potency?
potency, 200 potency, ma'am.
And how much dose?
200 potency, 2 doses, ma'am.
Okay. And then after that, you noted aggravation after 1 month.
Yes, yes, ma'am.
Hmm? So,
Yes, ma'am. We
and you did the re-case taking of the this case, and what was prescribed then?
then we follow the our Kent's 12 observation, and we follow their generals. There are no change in generals. We follow that patient is doing same his mind symptoms also. There is and concomitant symptom also. There is a morbid desire for
No,
earning for stool.
you didn't get my question. I'm asking. You prescribed Protontic. After 1 month, you found there is aggravation. The eruptions have increased. You did the case taking again. You redid the whole thing, right? So after doing the case taking again, what did you prescribe?
Placebo. Second
Okay,
best remedy.
okay. And then you waited again. So you mean to say this is a homeopathic aggravation that happened?
Yes, ma'am. Yes,
Okay.
ma'am.
Okay. Thank you.
Yes, ma'am.
That's all. Thank you.
Okay. Dr. Soumya Patra,
Yes, ma'am. Good afternoon, ma'am.
how did you decide that it is a homeopathic aggravation in second case, or it was not the reaction of the medicine? Normally when the molluscum, before improving, generally there is an inflammation and then it starts drying up and falls off. So
Ye-
what point you had taken, to say that this is aggravation? This was homeopathic aggravation.
Yes, ma'am. Yes, ma'am. I got it. Ma'am, actually, we got many cluster of cases, and after going through that, their lesson more or less painless. More or less painless. According to theory, we got many cases that mainly case are painless. But second case, we got soreness is there, and this second case, after giving the medicine, we got all lesson very much severe, painful state is increased. And this character remind me that this character remind that this is the not the aggravation of molluscum only. This is the medicinal soreness that increased her. These people, the character of the pain soreness increased.
And why did you choose only 3 cases? Since you were getting many cases, why didn't you added up all the cases? You were not able to follow up for 2 months, or what was the cause?
Actually, ma'am, we take many cases, but the technical problem is there. The patient is not maintaining their follow-up rules. Actually, I am doing my thesis work regarding delayed milestone, and we have to jot down these cases according to their progress. And but they not following the gradual accentuation. So we only taken only 20 cases, and after jot down that we got 3 cases. Remarkably, according to sequence, we got 3 cases. But we try to make a pilot project about this molluscum contagion in our hospital.
Okay, so this was a part of your thesis also.
Yes, ma'am. Yes, ma'am.
Part of your thesis. Okay, fine. It's okay, fine.
Thank you, ma'am.
Okay. Mhm.
With the permission of the chair, let me call upon our next speaker, Dr. Ashima Khulla. Dr. Ashima Khulla is pursuing her post-graduation from Nehru Medical College and Hospital, New Delhi. And the topic of presentation is resistant chronic folliculitis of the scalp in an 11-year-old girl child and its complete remission through individualized homeopathy, a case report. And her abstract ID is 268. Over to Dr. Ashima.
So is my screen visible?
Yeah, it's clear.
Okay. So a very warm good afternoon to one and all. And I want to thank you everyone for giving me the opportunity to present at this colloquium 2021. So here is my poster. So it is titled as Resistant Chronic Folliculitis of Scalp in an 11-year-old girl and its complete remission through individualized homeopathy. It is a case report. So basically, folliculitis is inflammation of hair follicles and it presents as pustular or nodular eruptions which becomes necrotic and they discharge their central core. And they are usually accompanied with symptoms like itching, burning, and occasionally there is stinging pain also, and usually it resolves within a few days, but somehow or sometimes it becomes prolonged and then it is termed as chronic folliculitis. So significance of this study is that there was a study which was done in 2016 and it showed that folliculitis and boils, they are worldwide prevalent diseases and they cause a great burden on the quality of life of individuals, around estimation of around 1 million disability adjusted life years. So the objective of the case report is to highlight the effectiveness of individualized homeopathic treatment in chronic folliculitis, which was resistant to conventional treatment, as in antibiotics, topical and oral as well. So the case was not responding to any of the treatment. So methodology, that presenting complaint was presenting with papulopustular eruptions on the scalp, and there was burning, itching for 2 years. And the case highlights were that the papulopustular eruptions, there were itching, burning, and stinging pains on the scalp, and it used to be aggravated in summers or heat, and it occasionally or somehow a little better in winters. Itching was aggravated at night, and but burning was also aggravated in warmth. So overall, the person was very hot patient. So all her complaints were aggravated in warmth, summer, and thermal reaction was also hot. The characteristic desires were of chocolate, butter, and smoked meat, and the rest physical generals were nothing significant. In the mental generals, there was a fear of dark and ghosts, so slightly fearful child, and she was very artistic. She used to love drawing and reading. And on observation, what I observed is that there was domination by father in some aspects, which I noticed. So the treatment history, the patient had already taken the conventional treatment. So like as in I told, like oral and topical antibiotics. Also, the patient had taken sulfur 1 dose a few months ago without any favorable effect from some another homeopath. And then she came with me with her father. So diagnostic assessment, it was clinically examined and clinically diagnosed on the basis of the nature of eruptions, its chronicity, and the associated symptoms as listed in the introduction. And it was differentiated from some similar looking diseases like seborrheic dermatitis, which usually involves the scalp, but characteristic scaling was absent. Also, the seborrheic distribution was absent. It was not involving the medial side of the eyebrows or the nasolabial folds. So after referring to the literature and all, the diagnosis was clinically made as chronic folliculitis. Therapeutic intervention. So after detailed case taking, carcinosin 200 unit dose was prescribed. It was followed by placebo for 2 months. So here is the case analysis. So rubrics which I took was mind ailments from domination, children in, mind fear, dark off, children in, head itching of scalp, eruptions, generals food and drinks, butter desire, because the desires were very marked, chocolate desire, and smoked meat desire. And generals heat sensation of, because the patient was very hot and all her complaints used to be aggravated in warmth or summer weather. So this was the case analysis. And talking about the results, So the primary outcome was that within 2 months of taking homeopathic treatment, literally all the visible lesions were cleared, and there was no recurrence for at least 3 to 4 months, because I followed up the patient for subsequent months, because skin complaints usually relapse. But in this case, there was no relapse of the symptoms. Also, there was no symptom, itching, burning. There was nothing left after 2 months. Secondary outcome, there was a change in DLQI, that is Dermatology Life Quality Index score, which I took before and after treatment. So before treatment, it was 8, because there was a lot of disturbance to the patient, from especially from the itching, and she could not concentrate on the studies also. So from 8, it reached down to 0, because after treatment there was nothing left. There was no eruption, there was no itching, there was no burning, and that is why the DLQI score came to 0. Also, the possible causal attribution was tested by modified Naranjo criteria, and here is the score which I applied. So I don't think it is visible enough, but the score was +7. So it was somehow, it shows some evidence that the medicine has acted, because it was in a very plausible time frame. So within 2 months of taking the medicine, the 2-year long problem, it got relieved, which was resistant to any other method of treatment. So this was the DLQI score, which was before treatment, it was 8, and after treatment, it was 0. So conclusion is that homeopathic medicine may be used as a standalone treatment in those cases which are resistant, as in this case. Also, what I learned from this case as a person is that being like individualization is always the key in any case in homeopathy. As if I would have gone with the specific symptoms, eruptions, pustular, so I don't think whether I would have been cured the patient or not. But in this case, individualization was the key, and it also demonstrated the importance of the individualization. That's it. And I want to thank Nehru Homeopathic Medical College and Hospital for providing all the related support. That's it from me.
Thank you, Dr. Rashima, for that wonderful presentation. And now over to our chair to have an interaction with Dr. Rashima.
Dr. Ashima?
Yes, ma'am.
Yeah, it was a nice presentation and a very good case how you have presented. Nothing much, but I just wanted to know, have you gone through some more research articles where this chronic folliculitis or folliculitis treatment have been done, and in a research methodology, what has been adopted and all? Have you gone through?
Yes, ma'am. I've gone through the related literature reviews, but in per se in homeopathy, I didn't find any article. So I went on. I studied a systematic review on the Cochrane's database. So that was allopathic oriented. So it was more of interventions related to topical antibiotics and all. But the structure was similar, as in they also used DLQI score. Also, they clinically diagnosed the condition. Many of the cases were clinically diagnosed. But per se in homeopathy, I did not find any article on chronic folliculitis of scalp. So I
Not of
searched.
scalp, but in general, I'm asking folliculitis, because research studies have been done on that.
Okay, ma'am. Ma'am, in general, I did not search. I searched specifically for the scalp only.
I think you should always look into that broader aspect also, and you get some more ideas. So don't
Yes, ma'am.
like, it's always like can say from generals to particulars. Okay, so let us be more broad. We should have a more broader view and to look at the things, and then maybe we can come down to something like this. And I really appreciate, and I want you to search again, and maybe you
Okay, ma'am.
can prepare a protocol for this specific disease condition, and with this specific objective of yours to look into the child cases in children. Okay,
Yes,
thank you
ma'am.
so much.
Sure, ma'am. Thank you.
Okay. And Dr. Ashima, your case was very well presented,
Yes, ma'am. Thank you, ma'am.
and you really brought out the importance of individualization of every case. Like in your case, it was only single case.
Yes.
Okay, so How many cases have you seen of chronic folliculitis besides
Ma'am,
this?
chronic folliculitis of scalp, the single case only.
The single case, and you got the results.
Yes, ma'am.
Okay, that's really good. But I think Dr. Pritha has made a point, and I think you should follow that also.
Yes, ma'am.
Okay. And I think some more graphic presentation would have done.
Yes, ma'am. Actually,
But
due to change of phone, I could not get the photographs because
okay.
otherwise I would have surely put it in the graph. But due to some
Mhm.
issue, I could not get those.
Because in posters, graphic presentation matters a lot,
Yes, ma'am.
right? Okay, that's all from my side.
Thank you, ma'am.
Okay. Mm.
Our next speaker is Dr. Jitan Reknalal Gori. Dr. Jigar is pursuing his MD from Dr. Emil Thavale Memorial Homeopathic Institute, Pahalgala, Maharashtra, India. The topic of today's presentation is application of concept of homeopathic pathogenesis in the management of autoimmune disorders of skin with respect to psoriasis and lichen planus, a retrospective case series study. And the abstract ID is 398. Over to you, doctor.
Thank you very much. I'll first share my screen. Screen visible?
Yes.
So good afternoon, one and all. Today, I'm obliged to present to you in my poster with with a lot of gratitude towards my institute who has provided me the opportunity to present this in the international platform. I would like to share my motivation behind the study where my mother herself was suffering from lichen planus itself, and she was being treated with all the conventional line of treatment from allopathic side where the use of corticosteroids was rampant, but it just did not only suppress the disease but also provoked more aggravation in her. So I've seen her suffering from lichen planus, and then my motivation came into play, which where I was just in my first year BHMS. So as you all know, autoimmune diseases occur when the immune system attacks self molecules as a result of breakdown of immunological tolerance to autoreactive immune cells. Gender, race, ethnicity, characteristics, and environmental factors are linked to the likelihood of developing an autoimmune diseases. Psoriasis and lichen planus are both immune-mediated skin disorders where characteristics, individual features represented by severe itching and scaling per se are present. Modern therapies for autoimmune skin disorders rely on general immunosuppressive medications that impair the entire immune system, often with high side effect profiles with broad immunosuppression, I would say. This type of study being one of its kind, where Dr. Hahnemann himself has stated that miasm as an fundamental cause of illness and homeopathic pathogenesis, which unveils the individualistic qualities of predisposition, disposition, diathesis, miasm, along with the understanding of susceptibility and sensitivity of the patient, are always useful in the holistic healing of the patient. The term homeopathic pathogenesis, which I've used in my title, is suggestive of that the term pathogenesis is used with respect to onset, duration, progress, location, sensation, modalities, concomitant, and the clinical presentation of the disease aspect, seat of the disease, or the rate of progression of the disease, the emotional concomitant or the physical concomitant symptoms, and also the pathological changes occurring at the individual level, and not forgetting the miasm as a core. The objective of my study is to demonstrate the use of these homeopathic pathogenesis points in the management of autoimmune disorders of skin, for which the methodology which I've used was in this observational retrospective case series study conducted. This was conducted for 18 months, where 23 cases of psoriasis and 7 cases of lichen planus each were selected as per the ICD criteria by simple random sampling. Data was gathered and analyzed in detail, and the follow-ups were critically evaluated after starting the homeopathic treatment. assessment was done to identify and understand various factors contributing in the genesis of the disease, thereby helping in the management of the same. So where after the study, which was a retrospective one, I was able to identify that there is a lot of importance in the management of the patient, where susceptibility, sensitivity, posology play a definite role in the final prescription of the medicines. Where in my case, in this study, I found that 16 cases were of moderate susceptibility and 10 were of high susceptibilities, and all these were connected to the posology, where these cases received either moderate potency or high potency. That was more frequent cases. More frequent cases were prescribed as 200 potency, and the type of remedial measures used in all these cases after analyzing all these detailed follow-ups was that only constitutional remedy helped in 13 out of 30 cases, where there was no requirement of any intercurrent remedy to be prescribed for the healing of the patient. And in 17 cases, definite use of constitutional as well as intercurrent remedy was needed to change the miasmatic block, to relieve the miasmatic block of the disease, which Hahnemann has always been talking about in his theory of chronic diseases, as we all know. So these both conventional line of treatment where constitutional and intercurrent remedy proved more useful and more beneficial, where the patients improved more significantly, where more than 75% of the subjective as well as objective presentations were improved in all these patients. The sensitivity which was identified in these cases was maximum patients were aware of high sensitivity, which again received moderate to high potencies as well. There were also a few cases where the sensitivity was so morbid that we have also prescribed LM potencies in few cases, which is rounding up to 8 in number out of 30. So all these criteria where the seed, the pace of the disease, the genesis, the miasm of the disease has been talked about by Hahnemann himself in his theory of chronic disease, as well as by Dr. Boger in his therapeutic pocket book, where homeopathic pathogenesis was described. So I would like to conclude my presentation whereby saying that only and only homeopathy is a science where we holistically definitely conclude the individual disorder of the patient, and not just treat like the modern way of treatment, and not just by selecting any particular approach. So hereby I would tell that holistic and individualistic presentations and treatment is only the essence of homeopathy. Thank you for allowing me to share this.
Thank you, Dr. Jiga, for that very informative and encouraging research that you have presented in your poster. Now I request our honorable chairs to have an interaction with the Dr.
Dr. Jigar,
Yes, ma'am.
in your cases, have you seen that how many psoriasis patients had family history of psoriasis?
Family history of psoriasis was only received in 3 cases out of all these
Okay.
30 cases.
Mhm.
Otherwise, there was other miasmatic load where many patients were either suffering from the family members were either suffering from diabetes or some cancer history, or some other autoimmune disorders like rheumatoid arthritis. So there were a few disorders which were prevailing in their background and was putting on a strong fundamental load on the patient.
So we can say that miasm was more dominant than the genetic factor in case of psoriasis, right? But a very well presented case, and really happy to see. And and you said you have used LM potency in 7 cases.
Yeah, in 7 cases out of 30,
Yeah.
LM potency was used with a very
Okay.
wonderful result, and more than 75% of both subjective and objective improvement was seen in these cases.
Okay. That's really good. And how did you decide about the tissued susceptibility in these cases?
Ma'am,
What was
obviously
the
in these,
criteria? Mhm.
my criteria for selection, homeopathically definitely, was where these patients were showing not just the pathogenic symptoms of psoriasis of just simple scaling or something, but they all had individual characteristics, like either of them would have burning, either of would have severe itching, or either would have some mental concomitant with the symptoms, either of the presentation of the tissue of the skin symptoms was severely seen. Like there were very few cases where there was low potency used. Only in those cases there were remarkably few symptoms. Characteristic symptoms were almost negligibly absent, where I could see only scaling and only auspicious sign was seen. Rest apart from these things. So yes, tissue susceptibility was decided on the number of characteristic symptoms the patient is throwing and how he is responding to the environmental factors around him.
Mhm.
The disease was
Okay.
same for them, but then the reaction of each individual was different. So this
Okay.
was the key.
Okay. Thank you, Dr. Jigar.
Dr. Jigar, compliments from my side also for this presentation. Uh, uh, all these 30 cases were treated by you.
Yes, I'm not just by me myself, but my institute, MLW Institute of Palgar, helped me to go through this study, where few of them were individually taken by myself, or others were taken by some other colleagues. As it was a retrospective study, I had to
Yeah.
take the help of my colleagues and my staff as well, senior members as well.
Okay. You have mentioned about dominant miasm as psychotic and 100%.
Yes,
Why
on all
so?
these, in all these 30 cases, to my surprise as well as my guide's surprise, we could not find a single case where the dominant miasm would have shifted to any other miasm. It was purely psychotic in origin. Definitely, there was fundamental load. Miasm would have I have found out to be syphilitic in nature as well as psychotic in nature both, but my dominant miasm of these individuals still presenting was of the psychotic, where none of these patients were either progressed to some severe complications of psoriasis, be it psoriatic arthropathy. None of them landed into any of the complications, I would say. None of them showed any cardiac complications, or even the severity of psoriasis itself, or lichen planus itself. So according to the time duration and their presentation and their response to the remedy, which was assessed through the remedy response evaluation form, which we follow here. So I was glad to see that all these patients were improving and not deteriorating bad. So we could conclude it as psychotic in.
Okay, and mostly which drugs you found effective?
Natramur, lycopodium, and calcarea. These three drugs were uh, seen in majority of the cases, along with intercurrent prescriptions, specifically of being thuja.
Okay. 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 Nice. Very good.
Thank you so much, ma'am.
And this is part of your dissertation?
Yes, it is.
Okay. Right.
So testing,
now-
testing.
Yes, Dr. You're audible.
Okay.
Now let me invite our next speaker, Mr. Bruce Leong. He's from China. The topic of presentation is sensation method in homeopathy for childhood eczema, and the abstract ID is 430. Over to you, doctor.
Okay, thank you. Let me share the poster first. Can you see the poster now?
Yes.
Okay,
Yes.
thank you. Okay, title is a case report of constitutional treatment in homeopathy for childhood asthma. Okay, hello everyone. I'm Bruce from Hong Kong Association of Homeopathy. Today, I'm going to share a case which is about childhood asthma by using constitutional treatment. Let's start from an introduction. A severe asthma case of a 1.5 years old toddler, 18 months little boy who suffered from asthma soon after birth. Taken into consideration the mental, emotional, and physical symptoms of the patient and the parents, the toddler was prescribed homeopathic remedies based on individualized constitution treatment of the parents. The asthma was finally recovered. The method. The case was taken in December 2018. The following points was observed by the parents, which is unique to us. The demographic, 1.5 years old, a boy. And the first one, with strong sense of territory, yelling when his sibling took his toy car, not allowing sitting or touching his own toy by other. For this case, his toy car and anything owned by him that is territory to him. His toy equal to territory. Second, proactively communicating with people. However, when the asthma activated, he become indifferent and to the surroundings. Third, losing interest in everything except eating and drinking. Good appetite. Keep on asking for food. As you see the picture here, you can see he's still very skinny. Okay, next one. Easy falling asleep while bathing in the water and listening to the music. 5. Can recognize the way home at very young age. When he almost got home, he recognized the environment nearby and the shop and the road. 6. Flat feet. Constitutional treatment. After a full case of the mother, father, Mr. and Mrs. Swan, and the baby W.S. Ward were clad, fecal peregrines was prescribed, which is Aphis. The kingdom, of course, is animal kingdom, was prescribed to father, and mother got a Capsicum animum 30C as a deep-acting remedies. Capsicum remedies is from Solanaceae, which is plant. Here are the rubrics list that searched by Radar Opus, and you can see there are 3 mental symptoms were selected, 1 general symptom and 1 physical symptom. And here is Mrs. Wong's rubrics. 3 mental rubrics was picked, also 1 general symptoms and 1 physical symptoms. That came out caps. And the differential diagnosis, based on the observation by the parents and the symptoms of asthma, patient was more related to father's constitution. According to the book of homeopathic proving of bird remedy, the proving of Brenda Canada matched with the constitution of patient WC1 as shown below. And you can see this here. Therefore, the remedy Brenta Canada 30C Aphis, same class as father, was prescribed with red dose 10 cups 1 shift for treatment. And the result, after Brenta Canada 30C, skin oozing and crusting aggravate after the remedy. And you can see this picture. This is before the treatment. And this is the after taking the first dose of Brenta 30C and the day after. However, the patient becomes a lot more curious and community, trying to put hands up to touch and get the food. Emotions tend to be more stable with lesser screaming, able to sleep longer time with better quality after 1 dose of remedies. 3 months later, upon treatment, the skin progress began to slow down and the itchy came up frequently again. The relief after each dose could only last for less than 24 hours. So it is so happened that the patient got an acute fever, so we need to re-examine the patient's constitution and discover that the emotion of patient changed to shock and nightmare fear. So we decide to apply modest deep-acting remedies kept for treatment instead. After an episode of acute fever, the asthma was making good progress, especially the face swollen and scalp patches reduced. Moreover, patient was able to sleep for a while whole night. He used to sleep for 1 hour only when asthma activated. So you can see the picture here and taking the CAPS 30C improvement within a month. After CAPS 30C, upon using mother's remedy, he got great improvement received in mental and physical condition. Patient loved exploring around and staying calm while sharing toys with sibling. No yelling anymore. Speaking skill and learning ability meets the standard of development curve. The asthma rush on the face and hands was gone. Only a bit of eruption remained in the lower back and the waist. Weight rose up to the normal level. And you can see this picture here. Okay. Overall condition was significantly improved after homeopathic treatment. Patients were in good compliance to the remedies. Maintenance dose of CAPS 1M was given as it needed. Discussion. There's no doubt that conducting consultation in preventable children is not easy. Case taking from parents allows practitioner to understand the parents' experience before, during pregnancy, and even in the delivery process. For the constitutional treatment, practitioner can evaluate the tendency of patient's constitution based on the children's personality, emotion, and physical status since birth and the status before and after asthma, so that practitioner will be able to select deep-acting remedies for young patients effectively. This clinical case proves that a feasible method to cure childhood asthma, which is chronic disease commonly seen in children in recent years. This table is Monarch table. According to the Monarch, it gives 11 out of 30 points. Therefore, it can be considered to be indicative of a good casualty score. And this is the information consent. Here are the information consent acknowledgement. This is all of my presentation, and thank you for your attention.
Thank you, Dr. Bruce Liu, for this presentation. We are requested to wait for an interaction with our honorable chair. And over to our expert panel.
Okay.
Mr. Bruce,
Yes.
it was a really nice presentation
Thank you.
of this case with all the photographs in place. And I just have one query, like the title of the presentation, the poster which you presented just now, and the one which we had received, and that says sensation method.
Yes.
And
Maybe
so-
there's some mistake. It is a constitutional treatment. Yes.
okay. And the drugs which you have mentioned for the treatment, you took the case for the father, for the mother, and you found the appropriate drugs for them, and then subsequently you have come down for what will be good for the child, right?
Yeah, right.
Which pharmacopoeia did you follow, and from which homeopathic pharmaceutical company you have procured these drugs?
Sometimes there's no perfect dose. It depends on the patient response. But in normal situation, just as you say, we constitution by the parents, father and mother. So we have to check the pictures of the patient, the baby, the children. So the first time we got the father's remedy first, and then when the response is not really good, so we decide to change to the mother's remedies.
No, I'm asking about these drugs. They are available from where? Any homeopathic pharmacopoeia mentions about these drugs? Apart from capsicum annum, the other two which you have mentioned?
Yes, mentioned in another reference. Yeah.
Can you share that?
Okay, maybe I share it later because I have only a bird remedies reference.
Okay.
So I have the Peter Fisher remedies reference.
Mr. Bruce, I'm
Yes.
Dr. Sangeeta, and it was a nice presentation.
Thank you.
Let's say it was a very good observational study, but we are not aware about those two medicines except for the capsicum. I mean, that is why she was asking, Dr. Pretha, from where you have procured those medicines. Are you aware, Dr. Pritha, about those two medicines?
No, ma'am. That's why I was curious to know.
Yeah. I mean, what is the origin? From where? I mean, which pharmacopoeia, how they are prepared, whether. So we are not aware before we comment on anything else, but the case was very well presented. I mean,
Okay, thank you.
your observations were right. So sometimes we have to study the case after studying the parents, because the child is so small, the child cannot express his or her symptoms, right? Cannot
Yes.
express except that he's feeling itchy or he's hungry. I mean,
Yes.
the basic
Yes.
things.
Yes.
That's
yes.
true. So all those other observations are very nice, but we cannot comment about the other two medicines, from where and how, I mean, those medicines have come.
Mm.
These are two homeopathic medicines, or these are some
Oh,
other medicines?
Okay. Oh, the medicine was come from European, yes, pharmacopoeia.
Okay, European
Yeah.
pharmacopoeia.
Yeah.
Okay.
Mm.
Okay. Um, and you call this as a chronic eczema of the child, or you'll diagnose it as atopic dermatitis?
Mm. Yes, and the diagnosis is sometimes the difficulty of my study is that sometimes when we handle such severe asthma case, the oversee of observation by patient and conservation medicine diagnosis in clinical.
Okay. Okay, thank you, Dr.
you.
Bruce. Thank you.
Thank you.
Thank you, Dr. Bruce.
Thank you.
Now we can move on to the next speaker. The next speaker is Dr. Manila Kumari. Yeah, she's a senior research fellow from Guru Gobind Singh Hospital, Patna City, India. And her abstract ID is 194. And the poster would be on the topic of totalitarian approach to tinea corporis, a prospective, non-randomized observational study. Over to you, Dr. Manila.
Thank you. I would like to share my screen first. Is it visible?
Yes, it's visible. You can go ahead, please.
Thank you. Good evening, everyone. As we all know, the skin diseases are common problems not only among young adults but also in middle and oldest person. This is a major health problem affecting the high proportion of the population in India, and there has been increased consciousness, especially among the youth, of their body and beauty, which makes them anxious too. And during my house job shift 2 years back, I came through many of the skin diseases, which in general requires long-term treatment, and the treatment is costly also. Among all the skin diseases visiting the institution, the most common was the fungal infection, and among them, the most common was found to be the tinea corporis cases, which is a fungal infection of trunk and extremities and caused by the fungi like microsporum, epidermophyton, and trichophyton, which represents itself as a circular rash with clear skin in the middle with severe itching, and overlapping rings are also found, and slightly raised eruptions are there. I took this topic as my research topic with the aim to study the efficacy of homeopathic medicine in the treatment of tinea corporis cases, and the approach was based on totality of symptoms. And the method of the study design was a single blind placebo-controlled study design with the sample size of 35, considering the inclusion criteria to be the cases of tinea corporis of suffering not more than 1 year within a defined age group of 20 to 40 years, irrespective of any sexual differences and socioeconomic status. And the symptoms correspond the symptoms complying ICD-10 criteria B35.4, and proper consent of the patients were also taken. I excluded the cases of tinea corporis in patients which do not lie in this defined age group of 20 to 40 years and the suffering of more than 1 year, and also the patients who have any systemic illness and who are not ready to give the consent for the study. Uh, uh, After that, I framed two hypotheses, null hypothesis and alternative hypothesis. The null hypothesis was supposed to be the improvement which has been seen in tinea corporis cases was not due to the medicinal effect, rather it was due to the management part, which I advised them during the study only. And the alternative hypothesis was seen that improvement was purely due to the medicinal effect, and the result was statistically significant at the end of the study, which I had to statistically prove and conclude the study. Steps which I followed during the study was that I took up the cases of tinea corporis from the OPD of my institution only, and after proper case taking of the cases, it was totality of symptoms were framed, and which was further repertorized using computer aided repertory, that was synthesis repertory from Radar version 9.2, which was provided by my institution only. The indicated remedy were prescribed with the proper management advised. I advised them to encourage them to wear loose garments and also avoid walking barefoots, and also sharing essential items like combs, towels, etc. And also noticed their individual trigger factors and asked them to avoid that trigger factors. The patients were asked to report after every 15 days or plus or minus 1 week may be there. If they needed in between, they can also come visit the hospital. In the next visit, proper follow-up was done. The same pro forma was followed, and assessment of the response to the previous prescription was marked from -5 to +5. That was based on symptomatological changes. Like if no effect was seen after the prescription, 0 was marked, and if some positive changes were seen in the symptoms observed, then it was marked from +1 to +5 with the increasing order of the amelioration of the symptoms. In the same way, it was marked from -1 to -5 with the increasing order of deterioration of the symptoms of the patient. With each follow-up, this was assessed with this parameter only, and the minimum 3 follow-ups were considered to be included in the case study, and if the follow-up is reduced by 3, then it was considered to be the dropout cases. The study considered the possible risk and the possible benefits also. The risk was that the indicated remedy may not be beneficial to the patient or may aggravate the patient's condition. And the beneficial benefits would be like effectiveness of the homeopathic medicine will be established and the patient will be cured. And also it will add up to the financial and treatment benefit for the suffering humanity. The result was analyzed and it was found to be the encouraging one. Observation which I drew during the study was like among 30 cases, I got 19 cases within the age group of 20 to 30 years and 11 cases within the age group of 30 to 40 years. And the cases were found to be more common in females and in lower middle class group. If we come to the result part, which I have shown in the poster also, there were 2 dropouts and there were 2 cases in which I couldn't get the result. That is, improvement of the case was not seen in the 2 results, while in the rest 26 cases, I found 6 cases were cured during the study period only, and in the rest 12 cases, the marked improvement was seen during the study, which were further cured also. The result among the cases and the control group were statistically compared and verified by using chi-square test. In chi-square test, and it was the calculated value of chi-square was found to be much greater than the expected value, and the p-value was found to be much less than 0.05. So the null hypothesis, which codes for the improvement, was not medicinal effect, rather it was a management part only, was discarded, and the alternative hypothesis, which codes for that the improvement is purely the medicinal effect, was accepted. Next, the study was a learning experience for me and also the first step towards the research work in my life. With experience, I figured out few of the limitations in my study towards the end. Firstly, the time frame was very short, and which was of 1 year only, and the sample size which I took was a smaller one of 30 cases, in which I found 2 dropouts were already there. And my study was in defined age group of 20 to 40 years only. And in future perspective, I would like to add that these limiting factors could be the considering points, and also there could be a randomized controlled trials for this topic also. I would conclude my study with certain things like totality of symptom, maybe the guide of selection of symptom, and also homeopathic treatment has proven or is providing the immense opportunity in the treatment of tinea corporis cases, and also going through the whole process of case taking, framing the totality, and reaching to the indicated remedy and desirable result. That is relief to the patient. I found that the general symptom of the patient should be given more important in respect to the vague particulars. That's all from my side. Thank you.
Thank you, Dr. Manila, for the lucid presentation. And now I would like to request the chairs to give their expert comments.
Dr. Manila, I would like to ask you whether it was an interventional study or an observational study.
Observational study.
Why do you say so?
It was also an interventional because it was a totally retrospective study.
No, you have mentioned it is a prospective, non-randomized observational study.
Yeah.
Yes, ma'am.
Yeah. The title itself says a perspective, non-randomized.
And then you.
Sorry.
So there are two things. Like one is you have given intervention with respect to the medicines. You have prescribed the medicines. So the title should not be observational study. Okay. And second thing is you said single blind. So how the blinding was done, if you can.
I took few of the control group also. 5 cases I took as a control group. And both the results from control group and the cases group were statistically compared. So, and I didn't mention the control group patients that they are taking placebo or what.
So is it ethically correct to prescribe placebo in a condition where the patient is really suffering?
So I took the minimum 5 control group, 5 cases in control group only.
Why?
I have to, for a statistical comparison between the study.
Is it ethically correct? Did you get ethical clearance for doing this study?
Yes, ma'am.
From where?
From the institution. And the ethical committee was formed at at my institution, and they
did you register this trial?
Registered this trial means what?
CTRI? Did you register this trial in CTRI? No.
No.
Okay. Fine. Thank you.
Well, Dr. Manila,
yes,
you have already suggested yourself that you would like to do a double blind treatment. This is what we were proposing to tell you. And the number of cases should be more, much more. And
yes,
please take ethical committee clearance. Okay? You have not done that. And register your case, as under CTRI, get it registered, take ethical clearance. I mean, only then you should, carry on with such research.
Ethical clearance was taken from my institute. That was a dissertation work, ma'am. So ethical clearance was taken at that time only.
But in that, normally it is not given. where the patient is at risk of increased problems. In that cases, ethical clearance is not given. Okay, and
Thank you,
must,
ma'am.
yeah, sure, you must, take the number should be more, and
Yes,
it should
ma'am.
be a double blind method, so
Hmm.
as to realize. Under double blind, you'll get
Okay.
cases in,
I will take this point, ma'am.
yeah, sure. Okay, that's all from my side.
Thank you.
Thank you, ma'am.
Okay.
Now, next, we would like to call upon our next speaker, Dr. Anil K. He is CMO NFSD, working with the Directorate of Ayush, Government of Delhi, India. The abstract ID is 251, and the topic is a retrospective cohort study on the effectiveness of homeopathic medicines in vitiligo. Over to you, Dr. Anil.
Good evening, everybody. It is really a honor and privilege to be here today. Let me start screen sharing. Hope I'm audible.
Yes, sir, you're audible and the screen is also visible.
Okay. A retrospective cohort study on the effectiveness of homeopathic medicines in vitiligo. Introduction. Vitiligo is an acute condition affecting 1% of the population worldwide. Focal loss of melanocytes results in the development of patches of hypopigmentation. The disease has a great potential for cosmetic disfigurement and emotional impact on patients. Evidence suggests that constitutional treatment with individualized homeopathic medicines are highly effective in vitiligo. Aim of the study to study the effectiveness of homeopathic medicines in vitiligo. Have done the study from the general OPD of Dr. B.R. Homeopathic Medical College. 10 patients of vitiligo reported to our OPD, and homeopathic medicines are given on individualized method. Medicines are given after detailed case taking. Patients of different age group were included in the study. I have given the chart here. So maximum patients are from 10 to 30 age group, 10 to 20 and 30 to 40. Total number of patients are 10, and 10 to 20 there were 3 patients. The cases were categorized into 3 stages: V1, that is active, V2, stable or quiescent, and V3, improving. Recommendation of the affected site was the primary outcome of the study. Out of the 10 cases, 9 cases responded well and showed considerable repigmentation. Average time for repigmentation is 7 weeks in segmental vitiligo and 5 months in case of generalized vitiligo. We have treated generalized as well as segmental vitiligo. So in generalized vitiligo, there are 7 cases, and segmental vitiligo, there were 3 cases. 6 cases of generalized vitiligo improved to V3 stage in 18 to 24 months. V1 stage is the most active stage, and there will be development of new lesions, and the borders will be irregular as far as V1 stage is concerned, and the lesion will be increasing. In V2 stage, this is a stable stage. The border will be clear, and as well as there will be no new lesions, and there will be no enlargement of lesions. And V3 is the improving stage. There will be no new lesions, and there will be repigmentation in V3 stages. So in case of generalized vitiligo, it improved to V3 stage in 18 to 14 months. 4 patients respond to sulfur and 3 to calcarea car in hypertension. I have given the chart here. What were the 10 cases? 4 responded to sulfur and 3 I treated with calcarea car, 1 with netromo, 1 with cephalanum, and the last one with phosphorus. So the conclusion, the study provides preliminary evidence that homeopathic medicines are effective in vitiligo. and studies with inclusion of more patients under rigorous settings are warranted. I given the photographs of two patients. One is a case of acral vitiligo and other is a case of segmental vitiligo. The second one is a case of segmental vitiligo. And in segmental vitiligo, complete repigmentation happened within 1 year. And the first photograph, that is the case of generalized vitiligo, that is acral vitiligo. It was having lesions on the both hands as well as feet. And it took around 18 months to 24 years for complete repigmentation. And he started repigmentation within 6 months. And this is my study. Thank you.
Thank you, Dr. Anil, for the coherent presentation. Now it's off to the chairs for further questions.
Dr. Anil?
Yes, madam.
Yeah, it's a very nice and precise presentation that you have made. My only concern was about the sample size and you mentioned retrospective. So
Yes.
these patients had already visited the OPD and their case records were available with you.
Yes.
Okay, so all these 10 cases you had treated, right?
Yeah.
Okay. Sir, my only request for taking up such cases that kindly use some validated scales like PASI and all for treating such cases. So I really believe that in near future, as you have already taken up such difficult cases, you will take up a study with the validated scales and you will have more evidence-based research work done on such cases.
Okay, madam. Okay, thank you.
Dr. Anil, I totally agree with Dr. Pritha that only that scale part was missing.
Madam,
of course, yeah.
Let me say something, madam. Actually, I'm seeing the patients in general OPD. So because of the crowd of patients, and so I followed a simple scoring method. That is the reason. Anyway, in future, I will take care to, based on VASI score or beta score to do the further studies, madam. Thank you.
Because once you think about retrospective study, then only you should have decided. Yes, those cases are, you're still following up those cases.
Yes.
So that time you could have decided and taken up the scale part. And of course, the number is really low to say much about anything. Okay. Rest, your presentation was good.
Thank you, madam. Thanks a lot.
Yeah.
Thanks to all.
Thank you, ma'am. And with your permission, can we proceed further?
Yeah.
Next, I would like to call upon Dr. Smita Brahmachari. She is a senior medical officer working with the Directorate of Ayush, Delhi. And her abstract ID is 33. And the topic of her presentation is Scope of Homeopathic Medicines in Childhood Atopic Dermatitis. So over to you, Dr. Smita.
Namaste and greetings to one and all. I am going to share before you two case reports of childhood atopic dermatitis successfully managed with homeopathic medicines who opted for homeopathic treatment after relapse and remission of skin lesion under prolonged allopathic treatment. The first case, which you see in the poster only, is a case of a male child of 3 years who presented with generalized severe painful pruritic eruption with oozing and crusting, especially on face and scalp, as shown in the poster. His suffering dated back from 6 months of age with a family history of asthma and allergic rhinitis both in paternal and maternal side. He was admitted 9 months back in a renowned hospital for the same, and he was discharged with a prescription of ointment and antihistamine, and he was regularly on this medication, but still there was a flare-up. This undernourished anemic child had a great liability to take cold, and he needed frequent nebulizations for asthmatic episodes. Initially, I prescribed the child sulfur 31 dose as he was under the prolonged use of skin ointment since his journey of onset. But on the very second day after taking sulfur 30, there was onset of fever, chilliness, and much irritability, both in physical and mental sphere. So I prescribed Arnica 30 TDS for 3 days. The rubric that was taken into account for prescription from Arnica was from synthesis repertory, and the rubric was fear approaching him of others, lest he be touched. Arnica in the highest rate, along with symmetrical distribution, sensitiveness of eruption, and also the difference of temperature, that is heat of head and cold hand and feet, also taken into consideration for prescription. The remedy reaction responded nicely, fever subsided with improvement in skin lesion. But after few days, the child again reverted back to his original state. The case was now again repertorized with synthesized repertory 9.1 version following Kent's method of evaluation of symptoms, as the case had strong generals and characteristic particulars, and he was prescribed nitric acid 201 dose. The basis of prescription being chilly patient disposed to gastroenteritis, offensive discharge, and discharges, craving for salty food, and excessive irritability both in physical and mental plane, along with second medicine in repertorization with highest mark. After few days, when nitric acid results came to a standstill, I switched to nitric acid warning, and which resulted in marked improvement, which you can see in the poster itself. Now I am switching to the next second case. That was a case of a female child of 10 years. She also had an generalized painful pruritic but burning bilateral symmetrical eruption since 2 years with regular use of steroids and antihistamines. She had an past history of measles and cough, otitis media along with cough coryza from change of weather, along with family history of asthma in mother. Initially, the case was prescribed Heparsal 30 in 30 potency for 5 days, 3 times a day, followed by placebo for 10 days. And the rubric that was used for the same was from synthesis repertory 9.1 version, and Kent method of evaluation of symptoms was followed in this case. The rubric was the strong craving for sour food, especially pickles. She steals the girl used to steal money for the same. So the first grade medicine were Corallium rubrum, Heparsal, and Veratrum, and I also in the repertorization, Heparsal came in the first rank. So, but when I prescribed Heparsal, the physical complaint was decreased slightly. There was not so much marked improvement. So again, I interspersed with 2 doses of sulfur 30. The justification being when the well-indicated medicine were selected but did not produce a favorable action, so it was interspersed with sulfur 30 along with a history of long continued allopathic medication, followed by Heparsal 201 dose. So the sequence of prescription in this case was Heparsal 30 TDS for 5 days, followed by 10 days of placebo, followed by sulfur 32 dose, and again after that Heparsal 201 dose. Regarding the change of medicine, that is the second prescription, switching over from one medicine to second medicine, aphorism 171 of Organon of Medicine by Samuel Hahnemann was strictly followed. So both the cases were repertorized using synthesis repertory 9.1 version, and Kent method of evaluation of symptoms was followed. Now coming to assessment of outcome was based on 4 factors, that is change in AD extension and severity, change in pruritus, general and psychological well-being, and improvement in quality of sleep. Constitutional homeopathic medicines prescribed singly in potentized form will definitely benefit the patient, and hence homeopathic treatment can be contemplated as an effective choice for patients with atopic dermatitis. But cases of atopic dermatitis require a long-term follow-up as the lesions have a tendency to recur. Thank you, LMHI organizing team, for giving me a golden opportunity to share myself through virtual platform, and thank you all for patiently listening.
Thank you, Dr. Smita, for the explicit presentation. And now I would like to request the chairs to interact with the speaker.
Good evening, Dr. Smita.
Good evening, ma'am.
It was nice to see your presentation and the poster. Very prominent skin lesions and the aspects. You are talking about atopic dermatitis. I would like to know that when the skin lesions reduced, was there any respiratory complaints that came up, or
Yes, ma'am. In the first case only, I had said you the child was taking frequent nebulization for asthmatic episode. Actually, after taking a homeopathic treatment, also the asthmatic episode decreased. In the first case only. Because in the second case, that is the female child, she didn't have an episode of asthma, but she had an recurrent tendency to have cough and cold, and that susceptibility also decreased.
okay? Uh, then in the poster you have mentioned aim to assess the efficacy of constitutional homeopathic medicines in cases of infantile atopic dermatitis. See, efficacy is a word when you mostly use when there is a comparison done with the control group. So you say that it is more effective, or it has, it is more efficacious. But over here you are talking about 3 cases. So it is the effect of constitutional treatment, basically. It's not efficacy.
No, ma'am, I have not mentioned efficacy. I have written scope. Scope of homeopathic medicine.
See, in your poster, aim to assess the efficacy.
Okay, it's okay. Done.
Because I really find you very like encouraging, and your approach very encouraging and all. And I really wish that subsequently when you take up such research works, then you should have a clarity that where the word effectiveness and where efficacy is to be used. Another aspect is about the objective findings, findings that will make it more evidence based. See, these photographs are definitely amazing, like amazing change in the skin condition. But if you include the like when you said that you have assessed the improvement on 4 criterias and you have talked about quality of life, so you could have used DLQI over here for this.
Because of OPD setup in dispensary,
I totally agree.
Person sitting, we are not able to follow that. Well, I'll definitely take a note of it, because I have 2-3 more cases of atopic dermatitis. I'll take into account.
And also, when you are talking about atopic, you should never leave that respiratory conditions, like because it alternates. That's a basic ICD classification.
Yes, the journey is correlated, because you can see both in first and second case, the family history is also strong, and both these patients also have an atopic journey from the beginning of childhood also.
Dr. Smita, we as homeopaths, when we go on a bigger platform, and I really want that the conventional system people, when they listen to you subsequently, they should say, wow, yeah, this is the approach and this is how the things are being done. So I wish you good luck for that, and it's nice presentation.
Thank you, ma'am.
Dr. Smita, it was a very good presentation. Considering, hello.
Good afternoon, ma'am.
Yeah, good afternoon. Considering like you had defined the scope of homeopathic medicine, these are actually atopic dermatitis is quite difficult to treat.
Yes, ma'am.
Quite.
Yes.
And like Dr. Pritha had said, it is correlated with respiratory. Either there is a family history or the patient develops. So since in both the cases, the steroids were used earlier, it becomes much more difficult to treat such cases where steroids were used. So the use of sulfur was really needed, and I really like that. But you didn't show us the photographs of the second case.
Ma'am, I was unable to make out in the canvas, because this was the first time I made a poster presentation. I was unable to make it out. Only I presented the first case. Second case picture is with me, but I was unable to do.
Actually, it should have less of writing and more
Okay,
of the
ma'am, I got it.
graphic
I got it. It's
presentation.
list of picture, as you said in earlier presentation. That is more we have to give to graphic one. Point
Yeah,
noted, ma'am. Point noted.
yeah. Bas, that's all from my side.
Thank you, ma'am.
Thank you.
Namaste, ma'am. Namaste.
Namaskar.
Thank you, Dr. Smita. I think this brings us towards the end of the session, as a few of our speakers couldn't join because of some technical issues. So now I would like to invite our respected chairs for the concluding remarks for the session. Dr. Sangeeta and Dr. Pritha.
Dr. Chesta and Dr. Thankaraj, thank you so much for being with us and bringing out the speakers in that sequence, and also helping us out to decipher and listen to them very nicely. And it's like very nice cases have been presented, and this is the actual groundwork which we do every day as homeopaths. And to all the speakers, as I have already mentioned, that I wish that whatever cases or case reports or case series they have presented, and take it as a stepping stone, and go ahead, whatever shortcomings they found and whatever limitations they found in their own studies, and they want to bring it out in a bigger perspective. So all the best to all of them, and I'm really happy to be a part of this curriculum, and thank you so much.
Thank you, Dr. Pritha, for the encouraging words. Now I would like to request Dr. Sangeeta if she can.
Yeah, I'm there. So initially, I would like to congratulate all the participants of today's poster presentation. They have all put in considerable effort in making the posters. And we all know that posters are great ways to communicate work to the scientific community. And normally these are presented in scientific conferences or symposiums, and with the aim that researchers, they are able to exchange knowledge, share research work, and they get the feedback also from the peers. Now, this is a great way not only to communicate the work, but also meet and network with the like-minded academics who have similar research interests. I would like one should focus more on communicating the central message of the research work. And I'll recommend them to use plots or appropriate pictorial diagrams. And the title, is very important. It should be concise, and it should be aimed at stating the conclusion from the results. Now, it should title that should make the conference attendees want to come and visit your poster. So rest is fine. I congratulate everyone and thank Dr. B. Thankraj and Dr. Chesta in conducting this program.
Thank you, ma'am. And regarding the posters, there's an announcement that the posters would be displayed during the colloquium, that is from 10th to 12th in the poster hall. And there the participants can answer the questions which the delegates can put across through chat. So they can visit their posters and they can subsequently answer the questions as well.
Yeah, fine.
Thank you so much.
So it was a pleasure to have all the dignitaries with us. And I would like to express my gratitude to our chairs for their valuable inputs and encouraging comments. I would like to express my appreciation to all the speakers for for their valuable contribution to this session, as the discussion has been effective in meeting its purpose. And I would also, on behalf of LMHI, I would like to thank the co-moderator, Dr. Thankraj, our coordinators for the session, Dr. Radhika and Dr. Swati, and the backend technical team for their endless support. Thank you, everyone.
Thank you.
And hope everyone join as delegates and attend all the sessions.
Sure.
Thank you, ma'am.
Thank you, everyone. Have a good
Thank you.
day. Yeah, thank you.